Anatomy Trains invites you to take your career to the next level with Anatomy Trains Structural Integration, ATSI. We're kicking off the next training this September in Maine under the guidance of Tom Myers and our expert team. Come map the pattern and shape the change in this transformational 3-part certification program. Visit anatomytrains.com for details. Hello, ABMP Podcast listeners. It's Kristin, ABMP's Director of Professional Education, inviting you to join us at the ABMP CE Summit Post-Op on Tuesday, November 4th. This online event, including 3 hours of CE, is free for everyone in the profession and features courses from incredible instructors Rochelle Clausen, Doug Nelson, Nicole Trombley, and Devonna Willis. Learn scar tissue, formation, and impact, and lymphatic drainage massage and hands-on techniques for post-operative clients. Register today at abmp.com/summit. See you online.
I'm Darren Buford.
And I'm Kristin Coverly.
And welcome to the ABMP Podcast, a podcast where we speak with the massage and bodywork profession. Our guest today is Doug Nelson. Doug is the founder for Precision Neuromuscular Therapy Seminars, president of the 22 Therapist Clinic BodyWork Associates in Champaign, Illinois, and past president of the Massage Therapy Foundation. His clinic, seminars, and research endeavors explore the science behind this work. For more information, visit pnmt.org. Doug is also a columnist for Massage and Bodywork magazine and has the feature article titled Massage Therapy for Pre- and Post-Surgical Knees in the autumn 2025 issue, and Doug is one of the instructors at this year's ABMP CE Summit Post-Op, scheduled to occur on November 4th. Register today at abmp.com/summit. Hello, Doug, and hello, Kristin.
Hello, it's really nice to be with you.
Doug, we are thrilled to be with you today. We've got so much to talk about, so I'm going to jump right in. You currently work at a clinic that includes both massage therapists and physical therapists working together under one roof. And I know that you collaborate with them often because you were telling me that you were collaborating with them as you were creating the content for your Massage and Bodywork magazine article and your upcoming CE course for the ABMP CE Summit Post-Op, all about post-operative techniques after a knee surgery. So tell us a little bit more about that collaboration and what you've learned from that. How has that really influenced you?
You know, it's been a wonderful thing, Kristin, because we had been sharing, clients, and I had met with the head of that physical therapy clinic 2 years ago and discovered that they had some extra rooms that they weren't using. And we at our main office were bursting at the seams, struggling for how to do the choreography with so many therapists in our clinic. And so we opened a satellite in their offices. And it's been so great. I have been there at that location. It's now been 2 years. And to work side by side with them, we share an office. They're not part of our clinic in that way. But more and more, as they see what we do and we see what they do, that collaborative effort is so much richer because we're in the same space. I see what they're doing with their patients. And I also have seen and had many discussions with them on how we can collaborate so each one of us can make the work more effective for the patients who come to be served. And especially that has been true with people with knee replacements and collaborating with these physical therapists to understand what their struggles are and how we can make that work more effective.
Doug, from your perspective, can you dive a little bit deeper on that? What do massage therapists bring to client care that complements the skill set of PTs and vice versa?
Yeah, so one thing, for instance, obviously if people are having a knee replacement, they're doing so because they have pain and limitations in movement, right? So then, of course, that affects the muscular system. And for instance, the stronger and the healthier you go into the surgery, the better your outcomes on the other side of that, right? And soft tissue work can be a really great thing in providing the health of that tissue before surgery. And then, of course, there are so many challenges after the trauma of surgery that soft tissue work can really embellish the really important work that the physical therapists are doing afterwards. And I think, if I may, one other point about this is I think a lot of people go into the idea to surgery with the idea of, I can't wait to get it because once I get it, it's going to fix everything and life's going to be good. And then, yeah, not so much, right? You realize, oh my gosh, there's so much work to be done. And I before the work happens, before the surgery happens, if during our work we begin to educate them as to, this is going to be a process, right? This is going to require some work. And there's work that we can do with the tissue. There's things that you need to do to go into that surgery. And it also prepares them in the mindset of, surgery is not going to be the answer. It's not the end result, right? It's part of the process because there's a lot of work to be done after the surgery. So it just sets the stage. And we're in such a great position because we spend so much time with clients that often other domains don't have the luxury of doing.
I love that. And you know what, Doug, here at the ABMP podcast, we love a good story. So I'm going to ask you to please share a story about a client that you collaborated with the PT crew on, and sort of how that journey evolved for them, how the working together really impacted the client pre, post, and recovery.
Several people come to mind, but certainly one of them who had a neural injury, which is not uncommon after surgery, right? And so people are told you need to do these exercises, that sort of stuff. But this person was in a lot of discomfort, and it had to do with the saphenous nerve, which is not uncommonly injured during the surgery. And there's work that soft tissue work therapy can do to actually speed that recovery. So for that person, it really did provide the pathway for them to get beyond the neural injury to be able to do the other work. And another person that comes to mind, we could do this like all day, but another person that comes to mind is somebody for whom just the musculature, especially in the quadriceps, just not functioning, not firing. And, if there's any tissue disruption that exists in the muscle, one of the first things that happen is just kind of a system shutdown, right? So if you try to push through that with exercise, it'll only increase the symptoms. And then for the person, for the physical therapist, that's just really frustrating because the client is feeling like, hey, I'm trying to do the exercise, but it actually makes symptoms worse. And the PT might think, well, you just need to push through it to get stronger. But it's a barrier that you just can't push through. And very specific, very precise soft tissue work can just kind of open that door so that exercise is now possible. And it's just in so many domains this happens. Like everybody says, motion is the lotion. You should do movement. Well, that's great to say if you're not the person in pain where movement hurts. If we then can be a catalyst to open that door, what a great service that we provide. So now for the patient and for the physical therapy, now the work can really generate benefits. And the work is hard, right? So if it's hard, you want to get something for that instead of feeling like you're constantly bumping up a barrier that you just can't get beyond.
Doug, we're kind of hinting around the edges here of my next question. What communication strategies and systems have you found most effective for keeping MTs and PTs aligned in treatment planning and client progress?
Well, one thing, if we landed on an island, right, and we felt like, oh, we see that these people really need what we have to offer, I have a really good suggestion. Speak their language. You cannot be frustrated if you feel like you have something to offer and you feel like, well, people just don't understand me. Maybe you're looking at this wrong. They don't need to understand you. You need to understand them. So I think it's first important to communicate in that way, in a way that they understand. And that, there is a language, I think it's called anatomy, and right, know your stuff and being able to communicate that clearly, to explain, here's what I'm doing it. Here's why I'm doing it. Here's what my expected outcome is. And if that outcome doesn't happen, here's my plan B. Everybody can relate to that. And again, understand the process, right? So, and that's why I'm so excited about the CE Summit and the article, because it helps people in our field understand what the struggles with someone going through that process, what they are. And then once you understand the process, then the question is there anything that we have to offer to make that process easier for everyone? But you can't just say, I've got a great answer and I hope it fits in somewhere, right? It's much better to understand the process. And then is there something that we can add to that to facilitate making it better for everybody? And I would say wholeheartedly, the answer is absolutely yes.
Doug, we've often heard about what could be considered turf wars, right? Between PTs and LMTs and whose responsibility is what and who does the client or patient belong to, or, that there's some conflict there between the two worlds. But you have been able to work so beautifully and collaboratively together. What advice do you have for practitioners as they're looking to or aspire to work more closely with physical therapists? How do they navigate those boundaries and do that without getting anyone sort of upset or in a defensive position?
Yeah, I love the question, but my answer is that first, that I've never really experienced that. I would say a couple of things. Number one, if you want respect, give it first. Number two, there's that wonderful line about seek not to be understood, but to understand. And so for me, it is when I, meet with, say, the physical therapist, or anybody, any discipline, it's like, tell me what your struggles are. What are the things that you find most difficult? And it's really understanding that first. And then is there something that I have to add to that? Instead of coming from, I want you to know about what I do and how great it is and all that sort of stuff. And maybe there's a place that this all fits in. Man, that seems like a really selfish place to begin all of this. So I guess I haven't experienced that. And maybe it's because of the perspective of starting first with it. What are your issues? Is there something that I can do to help? And whether that is physical therapy, chiropractic, primary care, whatever it is, I can tell you that I know a lot of folks in the primary care ecosystem, and folks with musculoskeletal, issues. That's not their favorite client. Let me tell you that, right? They often feel ill prepared to deal with that, and just don't know how they in that domain can really help. Is there something we can add? I think the answer emphatically is yes.
Doug, you have a really amazing setup right now with the integration between MTs and PTs. But how can MTs outside of an integrated clinic setting establish referral relationships, whether it's with PTs or other healthcare providers? What kind of advice do you have for that?
So I would say if you can, meet with different providers. It all happens like my relationships with any healthcare provider starts first with the client who's on my table, who tells me about this other provider that they are seeing. And when I hear several things about that provider that are really interesting and really good, we often end up connecting in that way. And again, just wanting to be curious, wanting to know more about what they do and how maybe there's something like, for instance, if it's an acupuncturist, how is it that can serve a population that I might be struggling with? And where does that fit into everything? If we approach it from respect and each of us seeing that all of us has something to add to this whole ecosystem, and everyone has at focus what is best for the client/patient, that's the place to begin. And I think any healthcare provider respects that.
Doug, I think a lot of listeners are going to be inspired by the collaborative relationship you have with that physical therapy team. And it sounds like with other healthcare providers in your community as well. What advice do you have for practitioners who are interested in starting to make those connections, but don't know where to begin?
Yeah. Again, I would say start by meeting those providers and wanting to understand more about what they do and what they have to offer, instead of, I'd like to meet with you to tell you all the great things that I do. That's not the place to begin, right? The place to begin is with curiosity and respect.
Doug, you recently won the Distinguished Service Award from the University of Illinois. The award is bestowed to those whose consistent, exceptional, and meritorious service to the University of Illinois has made significant impact on the institution's overall welfare and the advancement of its mission. Congratulations. Please tell us more, just a little bit, about what that award means to you and how you feel it impacts the massage therapy profession.
Well, it's almost like when you're reading that, it's like, really? They gave that to me? It's almost embarrassing to hear that, especially since I didn't graduate from the University of Illinois, right? And it's a humbling thing, but it is really for years of two things: telling the story of the university's global impact to the local community. And it started first with something called the Art of Science. Many years ago, I was 15, 16 years ago at my breakfast table reading a story in the New York Times about this amazing research project. I got halfway through and it said University of Illinois, Champaign, Urbana. And I thought, are you kidding me? It's a mile from where I'm sitting and I'm reading about it in the New York paper. And because of our background with anatomy, if you look at the Renaissance, right, the anatomy was also art at the time, right? And so there's that blend of science and art. And that's really the inspiration of, well, could we take scientific images and display them as art? I know it was a little nuts, but I got my friend Dr. Robinson, who heads the Institute for Genomic Biology, to give me 20 some research images. We had a gallery who volunteered to serve that. We had great wine, great food. I invited the business community. It was just a crazy idea for one night. It blew up. It was amazing how many people showed up. And it was really fun for the scientists also, because they thought this was a really stupid idea. And yet there were all these people who just were amazed and were invited to discover science through a surprising way. Like, just the image looked really cool. And then they looked at it and went, oh my God, it's like a cancer cell or a kidney stone or something, right? And that now it's become somebody's full-time job. There have been 15 local openings. There are openings around the country. It was at O'Hare Airport for 16 months. Actually, there was an attribution to Zeiss microscopes, and the president of Zeiss coming through Germany actually saw that and then was curious and came down to the U of I. And now there's a neat relationship with the university that way. So it's been a wonderful thing. And then many years of service, volunteering and heading committees at our local performing arts center, which is jaw-dropping, amazing, extremely high level. So
it's a beautiful testament to how much you are involved in, integrated in, and give back to your community. It's really, really an exceptional reflection of who you are as a human being and as a practitioner. So very deep felt congratulations for all of us here at the ABMP team.
Thank you so much for that. A couple of things. One, I think we as practitioners can do well by doing good. And if you do good in your community, one, I would like to point out, Kristin, that each of us reflects the profession to our communities, right? Like, what people think of massage therapy is really in large part what they think of that practitioner, right? So each of us are ambassadors for the field and mass, right? And I think that's something for all of us to take stock in and own that. And the other thing is that in our community, people know that we are an office that really does support the community, and people want to support an organization that then gives back and is part of the community, right? So in that way, again, we do well by doing good.
That's awesome. I want to thank our guest today, Doug Nelson. For more information about the good work he's doing, visit pnmt.org. Thanks, Doug, and thanks, Kristin.
It's a pleasure to be here.
Doug, thank you so much for sharing such incredible inspiration with us today. We appreciate you.